Hi, and welcome to Matt Holman Talks Mental Health, the podcast where I have the opportunity to catch up and talk to amazing humans doing amazing things in their world. Today, I have the great pleasure in introducing Alastair Deards to this conversation. Welcome, Alastair.
Well, thank you very much, Matthew, and thank you for having me on this podcast. It's going to be great to be able to share some of the work that we're doing.
Amazing. Welcome. So as I do with all of my podcast recordings, I'll introduce Alastair as I know Alastair, of course, and then I'll ask you to do your introduction because it'll be a lot more insightful than mine. Alastair and I, actually, we don't really know each other that well. We've been communicating through social media, through LinkedIn. And one of the wonderful and amazing things of this podcast is people reach out to me all the time asking, can we talk? Can we have a chat? Just to catch up on things. And because I'm really focused on delivering messages to an audience, I often ask them, well, would you like to join me on a podcast? And thankfully, Alastair's decided to join me today. So welcome, Alastair. Tell everybody a bit about yourself.
Okay, so my journey regarding mental health and my work journey regarding mental health probably started about 2.5 years ago when I retired. And through lived experiences that had occurred with my own family and some other families around me, I decided that I would try and help individuals on a 2 to 3 day basis. That soon became evident that more was needed, and I decided to write a paper to try and improve the systems that are currently occurring within mental health. That paper I pushed to my MP. She was very interested in it. Helen Grant, I live in Maidstone. She's been incredibly supportive throughout this. And from that point, we were unable to see the Department of Health up at the House of Commons. Unfortunately, we had a very nice response from the Department of Health, and they then closed the door because, of course, they know best. So we jumped a year. I had an illness that created a few issues, but during that time I realised that we needed to have more people involved. So June last year I set up a group which we called Mental Health Change. And from that group we have got doctors, we have got psychiatrists, and we have a steering board looking at the document that was originally proposed. We also created a number of different ideas, and we created our social media presence as well. We then presented all of that back to our MP, and she was very keen, particularly on the notion of a 555 national helpline. The very simple principle, we have 111, we have 999, and to have mental health recognised in the way that we should be recognising mental health, we want one national helpline that anybody in any situation at any point in time can remember the 3 numbers 555. At the moment, we recognise that a number of different helplines exist, but none of them are as effective as having that one number. Yeah. We're not reinventing the wheel here. This is all based on 1737 in New Zealand, which has been running since June 2017. So this is a proven technology, evidence-based proposal that works. So we have, since then, Helen Grant has sent this proposal out to Nadine Dorries. I've been very fortunate enough to speak to Dr. Rosina Allen-Khan, who is the Shadow Minister for Mental Health. And I'll mention Alastair Campbell because he kindly put the recommendation through for that to occur. And Rosina Allen-Khan actually said for all of our proposals, not just for the 555, that she would be interested in us actually having a roundtable meeting if they were in power. And I think that in itself shows evidence that what we are proposing is much needed. And in fact, when I spoke to Nadini Chakrabarti at the Royal College of Psychiatrists, who has kindly joined us very recently, she concurred with a number of the suggestions that we were making, to the point, as I say, where she actually has come on board as one of our steering committee, which is absolutely brilliant. Sorry about the noises. I need to make sure that is turned off.
Oh, don't worry. These are unedited, so it'll still be in there for anybody that's listening. I'm, you know, this is fascinating stuff, and one of the reasons why I'm really excited to have you on this discussion as well, Alastair, for that introduction and where you're at. And I know you've got lots of content you want to talk about, and we're going to get into that whole discussion around where you're at, what's going on, and you know, it's a fascinating journey, isn't it? Because you also retired at one point, and how are you feeling about that now? Just quickly around that conversation, we'll get into the details of the organization.
So yes, Matthew, I'm completely correct. I mean, I did retire, and the aim was to do lots of stuff that people do when they retire.
Yeah.
Then COVID came along, which has stopped a lot of that.
Mm.
As I say, the journey from June has been a very progressive one. I would say from June through to probably October, November time, I probably was doing 2 to 3 days a week. And then once Steve Phillip had presented something on LinkedIn, and I'd spoken to Alastair Campbell, everything started to go slightly crazy as more and more people got involved, as the knowledge of mental health change occurred on a daily basis. The number of contacts that were being made was increasing significantly. And then the big game changer realistically took place during December, when I found a company that would enable therapy to be offered to people from same day to within 48 hours with specialist therapists. And in having that conversation with Zane about how between us we could realistically make a massive difference in mental health, whereby a helpline would be available, and from that helpline you'd be offered numerous different signpostings, but also the option of therapy. Now you might think, oh, that's going to cost too much. Well, no, the trial that has actually taken place in Cornwall, the therapy is actually free to NHS patients. Now, this is where obviously we need to be working with the NHS longer term to establish agreements, etc. But the principle, instead of having to go to the doctor, potentially get into tablets, and then go back and maybe 3 or 4 months actually get around to seeing a psychiatrist, we're talking about attempting to prevent the progression of mental health from same day to within 48 hours. Now, I haven't so far met anyone who can't see that by addressing mental health at the earliest point in time is not going to be beneficial to anybody who is suffering. And the helpline is not just open to potential sufferers, it will also be open to carers, families, friends for advice. You know, that's the intention. As I say, it's based on the 1737 in New Zealand that you can look up on the web. It's going to be run by counsellors, so that when you pick up the phone, you will be talking to a counsellor straight away. That's all of the intentions of what we're trying to do. And at this point in time, we're attempting to get trials set up to enable this to happen, to prove this concept.
Wow, you know, it's a great cause, it's a great thought, it's a great idea. So those trials are going to be critical, right? So that's sort of part of prove the concept in many ways, and I'm sure there's a million questions that people would ask around, you know, how do you man it, how do you staff it, how do you know, see that working in a national scale? Because obviously if you think about charitable organizations that do support some of these conversations today, there's thousands of people that work in those organizations. So I guess there's a much bigger conversation that needs to take place in terms of lots of elements to this, right?
Okay, so just to address a couple of those points, the trial we're looking at, bear in mind that trials already taking place in Cornwall with 200,000 people.
Wow. Okay. That's good.
So that's on the therapy side of things. The addition we're looking for is to actually have the 555 number available, and where we're looking at, hopefully, we will be able to achieve that element as well.
Yep.
And again, it would actually be, the trial would probably be somewhere between 100 and 150,000 people it would be looking at.
Yep.
And it would, if it was successful, it would become the norm within that place. So it is interesting, and of course, if this proposed, if it's proven, and everything will be measured.
Yep.
So we will be seeing the impact on people as well, where they are treated. Obviously, if they just use the support line and there's no follow-up, then that's not achievable. But where it is achievable, we will actually be measuring that as well to prove the results. So I think what we do is we address a number of factors that currently aren't being addressed. Firstly, we're talking about getting people to therapists that specialise within the subject area that the patient is being treated on. Secondly, and most obviously, the immediacy, which I can't really say.
That's right.
But I think everyone will get the idea.
Yeah.
Of treatment being available,
yeah.
not forced in any way, only if people want to do it. The interesting thing so far is that the do not attend rate is down at between 5 and 10% from what has happened in Cornwall. In the NHS, it's between 20 to 40%.
And so when you say do not attend rate, can you just define what that means?
But for someone who is having a therapy session.
Okay.
So if you get your appointment from the NHS, it is on this date at this time. The do not attend rate is between 20 and 40%.
Wow.
And that's why you get the text come through where they say it costs the NHS £160 if you do not attend. They put all of that on there because the do not attend rate is so high.
Yeah, incredible. Yep.
And so, you know, there are massive benefits in this. By addressing this situation straight away, this is actually quicker than going to a doctor. As sad as it sounds.
Yep.
But, you know, in many cases these days, you know, we all hear about the fact that getting to see a doctor can take 2 weeks plus. You'll also find that doctors spend so much time with mental. I believe the figure is 40 to 50% of doctors' GP appointments are mental health related. So the massive benefit I see here is the fact that if we can take some of that away, this is going to free doctors up to actually do what they need to be doing in terms of treating people, you know, with physical illnesses and providing more time. The 10-minute appointment slots aren't always enough. And I know doctors can flex them, but, you know, they also have a lot of admin and stuff to do as well that is absolutely necessary for them to maintain the role that they're doing. You know, the upsides of this. Now, one of the interesting things that I haven't actually spoken to you about, Matthew, is money.
Yep.
In 2017, there was a report issued by the government, or requested by the government, which was called the Stevenson-Farmer report. Within that report, it stated the annual cost of mental health to this country in terms of lost output as being 74 billion to 99 billion pounds per year.
Yeah.
So my background is I was an accountant. And so when I look at that number and I think if we can reduce mental health by 30%, that will bring in over £20 billion worth of improvement to this country.
Yep.
By simply putting in these measures. Now, we do have other measures in place, which I'm more than happy to talk about, but this is the one that right now we are focusing on because we think it's the quickest thing that we are going to be able to achieve. We believe it to be totally practical. The other thing that is also interesting is I'm getting a lot of interest from around the world as well. So I have people in Australia talking to me, people in America talking to me, and Hong Kong and the Philippines, but actually also Sri Lanka. So there are a lot of people who are interested in the concept of what we're doing. And yeah, this is not, the thing which I always say to people is mental health has no boundaries. It's not the boundary of the UK, it's every country in the world.
Yep.
It's not the boundary of a political party, it impacts every political party. It impacts male and female alike. It impacts everybody. And I would probably guess that every single individual listener to this conversation will have experienced a mental health issue with one of their friends or family or even themselves.
Yep.
So this literally means, I would say, almost 100% of the population worldwide are involved in what we're trying to do here.
Incredible. Yeah, I would label that as being a human challenge.
It's a massive humanitarian effort. Yeah.
Yeah, absolutely. And you're right. It's a global challenge. Think about the pandemic and the impact of that, and that nobody's immune to it. And nobody's. Ultimately, we have to stay safe, but there is a lot of risk, and mental health is very similar to that. And we know, and I'm sure you're seeing that as well, is the mental health impact of the pandemic is going to be critical. So having systems like this in place where it's more proactive, and I think that's the key. It's not about, ultimately we want to prevent illness and challenges, but we want to be proactive when they come, and that's the big issue, isn't it? That's the bigger societal challenge that we've got.
Absolutely. And you use the word pandemic. I'd actually argue that this is the longest pandemic ever, because this isn't something that's just come about. Mental health illness has been around for forever.
Yep.
It's just we haven't found to date ways to address that. And with all that I'm saying, I'm more than aware that this is not going to cater for every single type of mental health illness. But if we can cover 50, 70% of the issues, and I believe we can, because we will be taking away the pressure that is currently on the mental health system. If we can improve individuals so that there is that team of people working in terms of the support and the carers and the patients all working together to actually get that improvement, it has to be better than the situation we're in today. And I think it will make a very, very significant difference.
Absolutely. I listening to what you're saying, I'm 100% sold that you've got a great concept and a great idea, and that's my opinion. And I share that with you, and others may feel differently. And I'm sure you do get a lot of resistance from people and in different places. And I know from our previous discussion, you definitely have had some resistance from different people who are saying it's not going to work. It wouldn't work. There's no hope. We're all going to have our own view on it, definitely. But you're right. Even if we can't solve everything and we can't fix, doing something is important.
Absolutely. And I think all of the suggestions that we actually have at Mental Health Change is that they are literally common sense. I mean,
that's too easy. That's too easy, Alastair. Sorry.
Why is it that we don't have a national helpline?
Yeah.
Why is it? I mean, so we've just installed, the NHS has just put in national helplines. And interestingly, before this conversation, I was mentioning this to Matthew. And Matthew, as we know, is big into mental health. except he didn't actually know that the NHS had got national helplines and had to go on.
Yeah.
And the way that you have to do it is you have to go onto a computer, you have to put in your postcode, you then get given a number, you then get triaged, and then maybe you'll get to speak to a mental health professional. Now, that whole process is going to take you 15 to 20 minutes,
Yep.
if you're lucky. And the reality is that for someone who is severely suffering from mental health, they have not got the capability to go through all of that process, let alone the concept of having to go through the internet, then having to talk to two people before you actually get round to doing anything. The principle of pressing 3 buttons, 555, and talking to an individual directly,
Yeah.
It's just so much common sense in comparison. For the life of me, I can't see why anybody can actually argue it's a better method, but they do.
And they always will, and they always will see a different way of looking at it, I guess. And it's about perspectives, isn't it? And some people just, yeah, I don't know. I don't have the answer to the others. So let's talk about, as we got about 10 minutes or so left.
Yeah.
I want to talk about the plan, right? What do you need to do, or what's going on, and what's going to happen next? So sort of, can you set out a timeline of hope?
Sure.
Let's call it a timeline of hope for the things to happen, because let's get some momentum behind this as well.
Right. So I'm going to cover this in a couple of ways. Okay. So in terms of timeline of hope, the good news is that on Friday we have the first initial meeting regarding the concept of the trial with decision makers. That is, as you can imagine, yeah, I'm slightly nervous about that. I can't lie. I'm also extremely excited about it, because if this gets the green light, then I feel we're truly on the way to starting to make a real difference. And this would be the concept of the 555 helpline, as I say, for somewhere between 100 and 150,000 people. And we're ready to get that running as quickly as possible. We believe that's perfectly feasible. It would take, longer. It would obviously take a lot longer time if we were doing it through the UK. So on the UK side of things, Helen Grant has gone back to Nadine Dorries with the information of what we're doing. We're also in contact with Jeremy Hunt at the Help Select Committee, so we're intending to get it through him, and I've already been back to Rosina Allen Khan, informing her of where we are.
Okay.
So we're pushing the UK as well. We've requested the 555 number through that conversation, and we've requested funding for a trial to occur within a county of the UK. So that's where we are on that side of things. And then I can happily talk to you about the other things that we're looking at doing as well.
Yeah, please do elaborate. Yeah.
So in terms of other things that we're looking at, we've proposed, and we know this is a big wish list.
Yep.
First simple one we would like to do is to have a mental health nurse or mental health professionals, which is actually a change to what we've got, linked to doctors' surgeries, so that a proper initial assessment can take place where required. Although we recognise the use of antidepressants and anti-anxiety pills can be useful for some people, it shouldn't be the first port of call. It isn't the nice recommendation, but it does tend to be what happens with GPs, unfortunately.
Yeah.
So that's the first simple one. We're also looking at attempting to get parity of esteem. Now, you might say, what's parity of esteem? Well, parity of esteem is effectively attempting to have mental health treated in the same way as physical health. Within physical health, you have areas like urology, oncology, fracture clinics, etc. Within mental health, you have mental health, and that covers absolutely every single form of mental health that occurs. So you have people that are having to address all of the different forms of mental health, which is actually impossible to learn all of them. It's impossible to be able to effectively treat individuals as in the way that they need to be treated. We need specialization to occur. So we need specialization for food disorders. We need specialization for PTSD, anger management, trauma therapy, all as one. And then you can have anxiety and depression with ECT occurring as another one. But then what you can do is you can actually have the staff who are working in those areas trained with those specializations at the most junior level so that they can contribute to the healing of the patients. At present, there is no way that can occur because you cannot be a specialist in 40 plus different fields. You know, there is nobody on the planet who can do this. And yet we perceive that a psychiatrist can treat all of these different things, make all of these different assessments, and have the power that they currently have, but they don't see the individuals. It doesn't make any sense. We need parity of esteem. We need, it's been spoken about for such a long time that all that has ever happened is talk, no actual action. Another area we would like to see is that if someone is, and we're coming back to initial assessment, and certainly Nadine Chakrabarti really likes this idea, is the fact that we do offer a voluntary 3-day, either 3-day or 3-night assessment within a hospital or a venue somewhere where patients can be observed and they can have a psychological and a psychiatric assessment. They can be talking to the staff who are involved with them, so that at the end of those 3 days, a proper plan is created. All of the people who will be supporting that person are given the correct authorities. They are all have the knowledge of who each other are. So there is no barriers. I mean, a lot of the problems that occur is trying to get things done. Yeah. There's so much time wasted. And Matthew, I think that sounds like it's from personal experience. Trying to talk to individuals and not coming up against, well, I can't talk to you because I haven't got permission to, or I can't do this. I can't. No, we want all of that to disappear. We don't want the time wasted on those calls. We want everybody to know who is involved from the start to enable this cure process that can be done in the community to happen from the very beginning.
Yeah.
So that if things are getting worse, we know who to contact. You know, we're not saying everything can just be gloriously transformed, but that's the principle of the 3-day plan.
Wow.
The final thing, the very final thing that we're looking at is that the fact that at present, and it comes back to the fact of what we're talking about, specialisation, mental health staff are running at about 25% shortfall. And there's reasons for that. There's reasons in the fact that, as I've already explained, they can't do the job they want to do because they can't get the training that they need to be able to do it. Secondly, they can earn more money by not being in the NHS or perceived to earn more money because they go out on supply. We've done a calculation that if we could do a proper active recruitment campaign and remove the supply and the cost of the supply, we could save, we could create 14,500 more jobs, 14,500 more nurses across the country.
Yeah.
To give you an example, I spoke to one person who's out on supply. She currently gets paid £17 an hour, and they're charging her out at £55 to £60 an hour to the NHS.
Wow.
So the company and she has to go through these agencies who have got these deals signed up with the NHS, but they are making £40 an hour for every single person they're supplying. Now, it is horrific that the NHS is being ripped off in this way. Absolutely horrific. But they know it and they won't do anything about it because these agreements are in place. We're talking money and, obviously the agencies look after governments, etc., etc. But this is the reality of what the situation is. And we need to get people on board to start tackling, not just talking about mental health within the NHS, we need to get people on board tackling the issue properly. Right. And we can quite seriously reduce the number of suicides significantly, reduce the pain and suffering for the individuals, reduce the pain and suffering for the families, reduce the pain and suffering for the employers and the work colleagues. This is all totally achievable with some very simple actions, in my view.
Well, there you go. What a plan you have evolved. And you know what? I think it's incredible to hear all of those elements, but how achievable they all are as well, in terms of just somebody taking that right ownership and positioning to make sure that that does happen. This conversation is fascinating. I really am invested in this, all of these thoughts that you're saying, Alastair. We are coming to the end of this conversation in terms of the times that we have. And I will ask you in a moment just to sort of give your final thoughts, what you want to sort of encourage. But from my side, I just want to say, huge thank you first and foremost for you participating in this chat. I've found it so fascinating and insightful. For anybody that's listening, mentalhealthchange.com is the website that you've created. So I encourage anybody listening, go and check out the work of mentalhealthchange.com. Have a look at what they're doing, the plans, and I know these things are all outlined in there as well, in terms of sort of more story. You can see some of the other people that are involved in the conversation or in the organization of that community. Please do follow this work, because this is fascinating, and it's something that I genuinely, fingers crossed, and every other piece of luck that I can send to you, Alastair, and your team to make change happen. And you've got this wonderful quote, and I'll let you close with it, or this wonderful thing that I resonated with, and I'll let you close. So final words from you, sir.
Well, thank you very much for those final words, and I will finish on that quote.
Thank you.
We also have created this year Young Mental Health Change as well, to address the situation for under 18s.
Yep.
That is run by a wonderful guy called Bill Buchan. It's only just started, so we are looking for support in that area. And if you have experiences on that side of things, please do get in contact if you'd like to be involved. If you'd like to be involved in what we're doing in terms of mental health change, again, you can get hold of us. Our email address is mentalhealthchange@outlook.com. We are on LinkedIn under Mental Health Change. I have a LinkedIn account, Alastair Deards, very easy to find. I have one of those unusual names that there aren't too many of us, so you will be able to find me quite easily. I look forward to meeting any of you. And to finish off, as Matthew said, together we can.
Brilliant stuff. Alastair, thank you. Together we absolutely can. It's so important. We work together on all of this stuff. As I always say at the end of these sessions, if you are struggling, if you do need some urgent sort of listening support, please do contact Samaritans, numbers 116 123. A listening organization, of course, that helps when you're feeling a bit low. Doesn't give you counseling, but just gives you a safe space to be able to be open and honest about what's going on. So again, thank you, Alastair. We're going to say goodbye to this conversation, and I look forward to hosting more of these conversations as we go. That's what it's all about. Lovely. Thanks very much. Pleasure.